A very warm welcome. You're watching One India English with me, Anubhuti Gaur, and today is the Pregnancy and Infant Loss Remembrance Day 2020, a special day to remember all those infants, all those babies who've lost their lives due to various reasons so far. So, this day is to create awareness on the issue, and to discuss this in detail, we're joined by Mr. Subhendu Bhattacharjee, who's the GM, Development Support Cry. Thanks a lot for joining us, sir.
Yeah.
So today is the Pregnancy and Infant Loss Remembrance Day 2020, and as we know, a lot of babies across the world lose their lives due to various reasons. So how do you look at this entire issue of infant deaths?
Uh, Infant death is one of the important development indicators. Development indicators, and India is contributing, particularly I would say neonatal death of one third across the globe. Sorry, one fourth. Earlier it was one third into 1990. So, Government of India has been persistently working towards reduction of neonatal death, and Government of India adopted Newborn Action Plan 2016, and the Government of India identified this issue across the aspirational districts, and which is trying to reduce the newborn death in support of Niti Aayog, UNICEF, and other civil society organizations in all aspirational high burden districts of India. And this is one of the core indicator. If India performs well, then that would improve the global situation.
Yeah, so what do you think are the real issues that are responsible for the infant deaths across the world, and especially India?
Uh, if you these reasons are many, but I will see if you see the data, so then you can see first reason is premature baby, low birth baby, which is contributing 3.5 million neonatal death. And there is another issue of birth asphyxia 20%, which is contributing towards neonatal death. Pneumonia, other infection are contributing 33%, and congenital malformation is contributing around 9%. And still, out of 1,000 child, children are coming as stillbirth, which are very serious issues. I think these issues, and if you look into one child dying 1 minute in India, and if you see the contribution of these neonatal death, they are contributing 72% of total infant death, and again they are contributing half of under 5 child death, this neonatal death. And mostly neonatal death happen, there are different periods. First is 24 hours, 7 days, and 28 days. So these are the issues which can be prevented.
Yeah, so if we look at the prevention of the entire thing, what are the kind of steps that one can take to prevent these high number of infant deaths?
See, first of all, we need to improve our ANC, antenatal care and postnatal care, which are most important thing. Another important thing is that see, there are issues regarding, for example, one lady by 23 years she's becoming mother of 4 and 5 children, and there is the issue of birth spacing. There are early pregnancies. These are to be controlled. Then our mindset needs to be controlled. If you see, India is the only country across the globe where girls, it is said that biologically girls are much more stronger than boys, but India is a country where girls death are more in terms of boys. Reasons, if you see, if you can see the difference of geographical situation also. Particularly North Indian state, mostly deaths of girls are higher than the boys. It shows that our patriarchal mindset is still in our mind, and we give little care towards the girl child. And if you see the seeking health behavior, so only 24% of children, neonatal children, are getting checked up by trained doctor. And if it is the case of home delivery, it is only 3% children are getting checked by trained health professional. So there are still whole lot of gap, and it is called 3Ds. One is delay at home, delay at transportation, and delay at facilities. The delay at home, when we say delay at home, it is mostly about birth spacing issues. It is mostly about mindset. It mostly about educational background of parents. If you see delayed transport, see, India has under NRHM, now NHM has 102 exclusive ambulance service. to ensure that high-risk pregnancies are referred to district hospital. But in most cases, there are many districts where district hospitals are not fully equipped. If they have infrastructure, I would say India has done fantastic development in terms of building infrastructure. Take the example of special newborn care unit, it is there. But if you go there, you see there is no pediatrician, there is no gynecologist, there is the anesthetist. So many of the cases you can see emergency delivery or operation is not possible, where ANM is doing that. So that is one of the issues. So we have to work at many folds. We have to work
Yeah.
at home. We have to work at transport. We have to work at health facility levels. But we have to give special emphasis on having trained health professionals, which
Yeah.
are the hour.
So if you look at the current situation right now, we're all reeling under the coronavirus pandemic. Do you think the pandemic has somewhere made the situation even worse?
Yeah, globally, many studies are coming out that it has created many bedrocks. Actually, I would say. So
Hmm.
now your people are actually ordered to go to hospital because of the.
Hmm.
As I said, there are many infection issues are coming already. 33%, which are contributing towards neonatal death. It's an infection, different kind of infection. Now people are really ordered to go out from home. If
Hmm.
transport, your ambulance service is not always available now, and health professionals are also really worried, which is adding much more problematic situation because of the COVID thing.
Hmm.
And another thing, because of the COVID situation, it is saying that there is dearth of food happening because there is loss of job, and particularly women are the worst sufferer in case of there is scope of less lively. Women are worst sufferer, and very honestly speaking, pregnant women are not getting due care, particularly in the families those who are from marginalized section of the society.
Well, of course, miscarriage is one of the essential reasons responsible for these infant deaths. So, of course, if women are not getting the kind of care they need at this point of time because of coronavirus pandemic or any other reason, so of course, this would lead to even more number of infant deaths.
Yeah, miscarriage, if you see in the current situation of pandemic, so for example, ANC, for first initial 3 months, ANC was not there.
Hmm.
After the ANC has been started, the full four ANCs are not happening.
Hmm.
People are really afraid to go to a sub-center or village health and nutrition day. So all four ANCs are not happening. The first one. Second one is that there is, as I said, there is nutritional deficiency at home because there
Hmm.
is loss of work and livelihood. So they are not getting adequate food at home and care also.
Hmm.
Number three is issue is that now your health system is also to entire system is geared towards facing the COVID situation. So this
Hmm.
some of this care, mother and child care are getting deprioritized because your
Yeah.
health system number of health trained professionals have not grown up, and they have
Hmm.
been given additional responsibility to COVID situation. So
Yeah.
these three things are actually contributing towards the more grim scenario during pandemic.
Yeah. So if we look at the entire the message for this day is to create more and more awareness towards grieving the loss of that child, and to actually create more awareness in the public regarding the entire issue. So what kind of measures do you think are being taken and can be taken to create more awareness?
So I think more emphasis has to be given house to house visits, regular counseling. Although Asha is there to do it, but
Yeah, so workers.
her hands are full, and ANM's her hands are full. Your ICDS workers are really afraid to go to the center. Forget about going to each house and giving the counseling, which is most important thing. First thing, that counseling has to be improved. Then
Hmm.
another thing, community awareness has to be increased because
Yeah.
this near infant death is actually contributing towards more population explosion as well also because
Hmm.
parents do not know whether her child will survive tomorrow or not.
Hmm.
And another problem which we have observed in the field, that if there is a case of third child or fourth child, they
Hmm.
will get maltreatment from your health services.
Hmm.
So in
Yeah.
case of second and third child, it's very difficult. Women are not interested to go to government health services. And COVID has given another situation that people really don't want to go to health services, fearing
Hmm.
that they might get infected. So this is actually you know, making situation bad to worst.
And also, you as an organization must be facing a lot of challenges at this point of time. So, what are the kind of challenges that you are facing under this pandemic to tackle this particular issue of the infant deaths?
First of all, as I said, our intervention is house to house intervention.
Hmm.
Earlier we could go to each house. We could
Hmm.
track the data. We could do the consultation. We could identify high risk pregnancy. We could arrange ambulance for reference to district hospital. First 3 months it was hampered due to lockdown, and your village health and nutrition day was not happening. So immunization we could not ensure. After the first 3 months, as I said, ANC part badly suffered, PNC part badly suffered. After first June 30th June of this year, so
Hmm.
our workers are going home now by keeping social distance, as well as they're ensuring that high risk pregnancies are identified during village health and nutrition and sanitation day.
Hmm.
So women are coming for their health checkup, and high risk pregnancies are being identified. But still, fears are there in the minds of people whether to go to district hospital for delivery or not,
Hmm.
because that fear psychosis is working. So this kind of challenges we are doing, but we are trying to overcome the challenges by going each house, tracking data of each woman, each child. That system maintain. We have this MIS system in place. But for example, if sudden only one village is locked down, then our field worker cannot go there. So it is becoming an impediment for us.
So, what do you think, as a developing country, India, what it has achieved so far in minimizing the number of infant deaths? Of course, earlier it used to be one third of the total deaths across the world, and now it's one fourth. But do you think that there's still a lot of work that needs to be put in to actually minimize the number of infant deaths?
So I think here we have to understand that intervention has to be at three levels. First level at home, we need to ensure that there is birth spacing, there is no early pregnancy, there should be less number of deaths so that parents feel that their child will survive. Number one. Number two, educate care has to be taken for pregnant mother. Then we have to ensure that there is proper ANC, there is proper PNC at home. ASHA workers are coming, trained doctors are coming. Then we need to ensure that, that there should be adequate number of trained health officials, doctor, ANMs are there, but numbers are less. In India, problem is that ANM is doing both work. They're doing work of midwife as well as they are doing other outreach services. So probably we can have two kinds of cattle like USA. There will be midwives are different and other immunization, other services are different. We can look into different levels.
Yeah.
Another important thing that we need to ensure that there is a medical college in all districts so that we have enough trained doctors, anesthetists, gynecologists, pediatrician, otherwise it will not work. Another is that if you see in a district there is SNCU, special newborn care unit, but there is no electricity. If there is no electricity, your SNCU cannot function. If there is
Yeah.
no pediatrician, your SNCU cannot function. These are the things we have to ensure. Then we have to ensure the education of parents, which is
Yeah.
most important. They need to, if you give the message, if they are not able to absorb it, so it is not going to help.
Hmm.
And another important thing is that like polio eradication program, we have to
Yeah.
make a universal program and target based program so that we can do faster. If you see that, yeah, India is improving, but pace is very low. We have to fasten the processes. We have
Yeah.
to have a separate mission for it. Mission is there. Mission like polio eradication mission we have to take care. Another important thing, for example, I could see there is some positive steps by the government during this COVID pandemic situation. If you take this kind of measures to arrest the neonatal death, maternal death, infant death, child death, definitely we can achieve the target and we can reduce the burden of the world itself.
Yeah.
And another important thing, if you see the cases of neonatal death, child death, maternal death, and infant death are mostly among tribal, Dalits, minorities and other backward caste who are actually out of your all health services. For example, if you look at the data, desegregate the data, situational tribals are very bad because they cannot avail your ambulance service.
Hmm.
They are reaching, living in far-flung areas. There are certain Palki scheme, for example, there in Uttarakhand. The Palki scheme, everybody is not availing. There
Yeah.
are other schemes in northeast part of India, but mostly they are not availing. Therefore, they are preferring to have home delivery instead of going institutional delivery. It has improved. Now, out of 10 pregnant women, eight is happening at the institution. It is improved a lot.
Hmm.
But again, another important thing: all institutional deliveries are not safe deliveries because
Yeah.
it is data has shown that trained doctors are not there. So
Hmm.
delivery is done by ANM only, and she might not be able to identify high risk cases which can be referred immediately. Even in case of high risk cases, these cases delivery should not happen in your PHC or your CSC. It has to go to district hospital. Then you
Yeah.
can ensure survival of children from asphyxia, maternal death, and then you can ensure urgent delivery, sorry, urgent surgery also, which would really save the lives of mother and child. This part we have to emphasize on.
Yeah. So also, sir, talking about this particular day is also to remember all those infants, all those babies who have lost their lives. So do you think it's kind of very, of course, it is a traumatic experience for a family who've lost a child. But do you think that is very difficult for the sometimes for the family to ever come out of that trauma? And this day somewhere promotes people to talk more about it.
Very honestly speaking, if you go to particularly Mushawar family, tribal families, mothers does not have time to cry for her child.
Hmm.
Immediately after death, she goes to work, and she works before the day of pregnancy. If her
Hmm.
child dies, she comes there, so she cries for a while. After that, everything is normal because they have to go to work for survival because their three, four children are left who are hungry.
Hmm.
So they do not know actually how many days their children will survive. And I can tell you my experiences. Apparently, if you feel they are not emotional, they are emotional. But this is their fate accomplished. They feel sometimes. But they don't have time. Because here important thing is that government has to ensure that unorganized sector workers, particularly women, should get same facilities what organized sector of workers are getting. If that is not happening, for example, 6 month maternal benefit schemes are there. 6 month paid holidays are there to take care of herself and the children. But in case of unorganized worker, as I said, she has to work before delivery, and she has to work after death of her child. So this is
Hmm.
the so PNC is not happening. She is not getting rest, adequate rest. So her health is deteriorating. She cannot breastfeed. So your cholesterol feeding is one of the another important challenges. 54%
Yeah.
cases cholesterol feeding is not happening because there are other myths are there. But if cholesterol feeding is happening, but she cannot do exclusive breastfeeding for 6 months, she has to go for what?
Yeah.
There is another alternative. As I said, if she is getting some kind of maternity entitlement, like
Yeah.
organized sector workers, then definitely it will reduce the burden of this lady adolescent. It ensures survival of mother and child.
Yeah. But that is what is there. We need more awareness. We haven't reached a point where people would start honoring those babies who've died, or also try to understand the reasons behind all this, why this happens. And of course, that is much more prevalent in the rural areas and the tribal communities where they do not even have the time to think about what has happened, and they just go on with their lives.
Yeah, obviously awareness is one of the factors, but even along with awareness, if you are not able to give them facility to avail, then their awareness will remain as an information. It will not be converted to knowledge and wisdom. Suppose if she knows that she will get 1,000 rupees per month as an entitlement for 6 months to take care of her child, probably she will not go to work next day. Or if she gets some entitlement before the delivery, of course she will take stay at home and take educate rest and care and nutrition. But nutrition part is seriously compromised at home. No special care is given to mother who is pregnant. It's same food is for all. More some of the time, if children are hungry, she will give a hard food to the child and she will remain hungry. And you might have heard that iron tablets, some women are not interested to take because you cannot have your iron tablet in empty stomach. In empty stomach, the iron tablet is taken, it will create acidity. And simply they throw iron tablets in villages when there is acute hunger issues are there.
Hmm.
So we have to understand the issue holistically, and we have to implement the program holistically. Only one kind of flagship program is not going to help probably. We have to arrest these birth spacing issues, early pregnancy issues. We have to ensure that they get all the benefits. We have to ensure that transport facility is there, and you have to ensure that health facilities are there. All things have to be brought into a mission mode. These three pillars: facilities at home, facilities and transport and other thing, and your healthcare facility. These three pillars have to be work in tandem to arrest this
Yeah.
news.
So, sir, what is your final message to all the people out there on this Pregnancy and Infant Loss Remembrance Day 2020?
I think it should be one of the major national priority. As I said, priority is like mission, and we have to ensure that these all three pillars together work very efficiently, and so that we can reduce the death of neonatal and maternal death, child death, and infant death, and they should have educate access to nutrition. So all things we have to work together with the government, civil society, every citizen should take responsibilities, and we should work towards eradication of this neonatal death. We have to meet the target of SDG. It is part of our Constitution, Article 21, right to life. It is part of our Constitution, Article 47, Directive Principle of State Policy. It is part of our Constitution, Article 39 of the Indian Constitution. And it is part of our Article 15.3 that government should take special care for the children and women. It is there already, Article 15, sub-article 3. We have to work. Our Constitution maker imagine that thing before 1950, that we need to work towards nutrition, education, right to life. So that now time has come that we should work together to fulfill the aspiration of our constitutional makers. As
Okay,
well as
thank you, sir.
our global commitment in UNCRC SDG, we have to fulfill this.
Thank you, sir. Thanks a lot for joining us for this wonderful discussion on this day of the Pregnancy and Infant Loss Remembrance Day 2020. And we hope that the government and the world comes together and works towards this important issue.
Thank
Keep
you.
watching One India English.
Thank you.